Charlie, back to you both.
Thanks very much, Matt.
Thanks, Matt. 12 minutes past 8 is the time now. There are currently 2.4 million veterans living in the UK, and according to a survey from NHS England, around 60% have found it difficult to ask for help if they're struggling with their mental health.
And GP surgeries in England are now being urged to sign up to a new scheme to improve medical care and treatment for those who have served in the armed forces. Our reporter Abby Smitten explains.
I joined the army in January 2000 at the age of 18. Did 2 operational tours of Iraq, and then I left the army in December 2013. There's no kind of training that can mentally prepare you for what you're going to experience, and you don't know how your body and your mind's going to react until you're in that position.
John Lynn served with the Royal Electrical and Mechanical Engineers for 13 years. When he was discharged, he was left struggling with both his physical and mental health.
When I came back, everything that I'd experienced, I kind of marked it up and pushed it away to the back of my mind in a box and said, do not open. And that box just sat there for a period of time doing nothing, and then all of a sudden it just kind of exploded out.
It was a difficult time for John and his family. His wife was so concerned she took him to their GP. One of the first questions his doctor asked him was simple. Have you ever served in the military?
Tom, come in. Good to see you.
Hiya, Dr. Simpson.
Come and have a seat, please.
Thank you.
Hampton Surgery in the West Midlands was one of the very first to become veteran-friendly accredited. The accreditation means GP surgeries will log if a patient is a veteran and receive specialist training to help point veterans towards specialist support.
We need to know someone is a veteran, and we need to show an interest in the fact that they've served, and just wonder if their condition could be as related as to their service. This programme will help take work away from GPs, because once they recognise that someone has got a mental health problem, then there's a really good referral pathway that's going to help them.
I don't know what it is. I don't think it's anything malign, but, you know, I'm here, so I might as well get it checked.
Tom served in Afghanistan.
As the Taliban moves in, the West moves out.
When the Taliban returned to power in 2021, he was watching from home and found himself struggling to cope.
What I certainly hadn't realised, and I feel quite naive about it looking back now, but I hadn't realised that seeing these stories in the media about an environment that I'd known and I'd served in and I had some very strong feelings about was surfacing a lot of thoughts and feelings that I hadn't really considered for quite a long time. When I came to the practice and I spoke to my GP about that, you know, he was so quick to realise that that was part of the problem that I was dealing with, but that wasn't something I'd seen for myself.
I didn't feel like I had the right or I could deserve any treatment. When I came back from Iraq, I was healthy. I was lucky, you know. There were people who were far less fortunate than that and were injured and didn't come back in the line of duty.
John's GP surgery immediately offered him specialist support. He was seen by nurse Helen Hurst.
Oh, hi, John. Oh, so good to see you.
Today, they're reuniting for the first time in more than a year.
How are you?
I'm okay. I'm doing okay. I've had some ups and some downs.
I'm proud of the NHS for stepping up and you know, the Veterans Covenant. We've got that whole duty of care towards our armed forces, and you want to make that difference as well to their community. And lives like John, you know, when he tells you the difference it made, I feel honoured that I've been part of that journey with him.
It's not something that I'll ever be kind of cured from. I've just got to manage it, so having the ability to drop back in and get additional support when it's needed is kind of vital for me. It really did save my life. I don't think I would be here now had she not put that work in and that time in, and you know, she didn't know that it was helping me and she didn't know me, but just having someone who thought, you know, we really need to look after our veterans, and you know, the passion that she showed, it made a huge impact on my life.
John Lynn ending that report there by Abby Smitten. Well, we're joined now by Army veteran Paul Findlay and Dr Emily Brooks from the Royal College of GPs. Good morning to you both. Paul, Really interesting seeing that report and the help that's being asked for. Who are you? What's your experience?
My experience, probably like a lot of other veterans out there, joined the army quite young. So joined the army at 16, grew up in Glasgow. There wasn't a huge amount going on. Army seemed like a fantastic career opportunity. I was very fortunate to have a great career in the army. And then in 2009, I had done a few tours of Iraq before that, but I went to Afghanistan in 2009 and sustained some injuries, which meant that I had to be medically discharged eventually out of the military.
What were the injuries?
So I was involved in an ID strike in May, and it resulted in both legs getting pretty badly damaged, but the right leg being amputated eventually.
Below the knee?
Below the knee, yeah.
And this is the remains of your tank that was attacked?
Yeah, so it's a Jackal patrol vehicle, which looks like it's been opened with a very big can opener there, but that was a result of an explosive device which we went over.
When you had the amputation, what was life like for you after?
It was interesting. I mean, I was very fortunate that I'd spent 10 months with both my legs, and they were, the medical staff had tried to save what they could, and I'd been in for a number of different surgeries. And then being at Headley Court, which was a military rehab centre at the time, I had seen what other people were achieving after limb loss. So I felt quite assured that the support I was going to get and the rehab I was going to get would actually lead me to live a very fulfilling life.
Physically?
So, physically. So, at that point, it was all about the physical health. I just wanted to walk again, sick of being in a wheelchair, wanted to get up and mobile, and I was very fortunate that I had a really good, care team around me that supported me to do that.
I emphasise the physical.
Yes.
There.
Yeah, I mean, look, there's very few people that go through that level of trauma that don't have a mental health aspect to it. Mine came much later, so my mental health actually deteriorated after I left the military. So I transitioned out in 2012. Was very fortunate to land a really good job in the city, and it was a couple of years after that I left that my mental health started to take a downward spiral. And that was, I don't know what the trigger was. I don't know if it was just at that point my physical health had got to a certain point where I was actually didn't have to focus on it anymore and I could kind of switch. And then, that's when I started having to engage the relevant services to get the support that I needed.
Emily, that leads us nicely to you. Engaging the relevant services, I think the phrase, this is people who need help and maybe aren't getting it. What's the situation now and what could change?
So we know that that veterans often can have distinct health needs, and we also know that from research that veterans can be quite reluctant to come forward and seek help. And we also, from research, know that GP practices, only about 50% of GP practices knew who their veterans were and may have had less knowledge of the specific referral pathways for veterans, such as Courage and Op Restore, which are referral pathways for physical and mental health needs for veterans. So that's why the scheme was developed by the Royal College of GPs and NHS England to address this. And so the scheme gives a free package of support to GP practices to help veteran patients and to break down barriers, so hopefully veterans will come forward and get the timely support and help that they need.
And you talked about that reluctance to come forward initially.
Yes.
I mean, that's problem one, isn't it?
Yes.
I mean, it's one thing making sure you know how to help people when you see them. But if people don't come forward in the first place, that's a huge problem.
Yeah, and I think that's why it's important that practices do know who their veterans are, because sometimes people present not in a typical way, maybe with a mental health problem. So if the GP knows the person's a veteran, they may be able to put their problem into context and get them their help that they need earlier. But I think also, I mean, we know from veterans, if their practice is veteran friendly, it really breaks down barriers for them, and it just really helps them to get their foot across the door and ask for help in the first place.
Paul, you've got family now, haven't you?
I have.
You got daughters.
Two daughters and a wife.
Just so people get a kind of sense of context, obviously you had your injuries way before they were born.
Yeah, quite a bit before.
So they only know Dad with a prosthetic limb.
Absolutely.
But did they? How? What's it been like for you sharing as and when you have been able to, your story with them, and I suppose with other people as a result of that, with their, I don't know, school friends and...
Yeah, so it was quite, the standing joke at nursery and then school was that Eileen Erin's dad had a robot leg. So that was always the kids would just kind of stare and didn't really know what to say. And I've always been quite open about it. If I can help kids desensitise that disability is not a stigma, it's just part of everyday life, then fantastic. My daughters, my eldest only started really asking last year. So around about Remembrance Day last year, she started to so what actually happened? And I'm very transparent. I didn't go into the kind of gory details, but sitting, explaining kind of the impacts and what happened. And she's also, like a lot of my friends I was in the hospital with are missing arms and legs. And so they've grown up around people with, various levels of disability and ability. And to them, they just see the people. They don't see someone's prosthetic,
Well, that's wonderful that it is like that. Was it... I think you probably answered the question in the way what you just said, but was that difficult for you or triggering in any way, just to kind of, or was it liberating to just be open, as you clearly have been?
Yeah, I think I've always spoke pretty openly about my physical and mental health. I feel that, I've been put in positions where I've had a voice. I feel very lucky about that. I was invited to be part of the NHS's patient participation voice group, so I've always... So I get to represent other veterans and make sure that their voices are heard, and especially around complex trauma and mental health. But then also, working in the military charity sector previously, gave me an insight and an ability to speak about it. So, look, not everybody wants to speak about their condition. Emily, spoke about one of the challenges as veterans, as the GP practice has been able to identify them, but not every veteran wants to come forward and give their status. What I would say is that they probably don't want to come forward, in some cases because they don't know the support that's available. So by making yourself known to your GP practice, that will make your life better. It made my life better when my GP practice is GP accredited, is veteran friendly accredited, and that made my healthcare journey much better when I left the military. And for the practices themselves, being able to then make sure that the veterans are getting signposted to the right service at the right time is also crucial.
Paul, we appreciate you sharing your story with us this morning. Thank you very much. And Dr. Emily Brooks, thank you for your time as well.
Thank you. Morning Live takes over after us at 9:30. Gethin and Kimberly are going to tell